Hello, I'm Dr. Rahul, consultant orthopedic surgeon, arthroplasty and arthroscopy surgeon, Asvins Hospital. Today we wanted to have a chat regarding the upcoming World Arthritis Day on 12th of October. The World Arthritis Day as such was started back in 1996. The main concept of having a day for arthritis as such was to mainly increase awareness regarding arthritis. So coming to the word arthritis as such, if you do split it into two of arthros, which means joint, and itis, which means inflammation as such. Okay. So coming to arthritis in general occurs in a lot of throughout life as such, but more commonly occurs above the age of 65. But sometimes it also does occur as early as infancy and childhood, unfortunately, in a few patients. So the joints that are involved are also majority would be the larger joints such as the ankle, knee and hip is more common because these are your weight bearing joints. But unfortunately other joints such as elbow, shoulder, although rare, and even finger joints is definitely possible. Now coming to arthritis in general also, just to increase more awareness regarding the condition because some of these are treatable. Arthritis is again subcategorized into two, primary and secondary. So first let's deal with the primary arthritis. So firstly let's discuss about primary arthritis. Primary arthritis is what everyone are aware of. This usually occurs due to the regular wear and tear of joints, more commonly seen in elderly patients above the age of 60-65. In India, we see a lot of knee arthritis, which is usually mostly primary arthritis. Primary meaning there is no underlying condition as a precursor to the arthritis that is seen. Usually in early stages of primary arthritis we can prevent further progression by avoiding loading of the joint. That means putting the joint through high stress such as squatting positions should be avoided. But main modality of treatment would be again physiotherapy and strengthening of the thigh muscles or other muscles in the case of knee or other muscles in the case of other joints that basically help unload the pressure on the knee, and other measures such as reducing weight through either diet or cycling or exercises that don't put the joints through extreme load such as cycling or swimming as such. So that is primary arthritis. In India we commonly see it in the knee, yes, also the hip occasionally. Ankle arthritis is pretty rare in India. In these conditions, if your primary modality of medication and physiotherapy doesn't solve the issue, you go through a more aggressive management which would be again nerve blocks have come in, which are a more conservative form of modality, and the other would be replacement. A replacement option is available for the knee and a hip. Ankle also is available, but the success of an ankle replacement is still under study, and right now it's at around 5 to 10 years duration. So coming to the secondary arthritis, which is mainly the point of the World Arthritis Day and where we want to create awareness, is usually because of another condition. So usually the more common condition that causes this secondary arthritis is rheumatoid arthritis. So rheumatoid is an autoimmune condition where secondary arthritis basically means arthritis that is occurring secondary to another medical condition. So there are numerous conditions that do affect joints in our body. So of these, rheumatoid arthritis or crystal-induced arthritis or SLE, these are a number of conditions that do lead to this. Why we need to create awareness is if we do identify and diagnose these conditions early on, during the early stages, and we use the medication as such, what happens is we do give a lot of relief to the patient in terms of curtailing the pain, in terms of giving him comfort, symptomatic relief, and also we do prevent the progression of the condition, the medical condition as such, and also prevent arthritis from developing as such. Of these, the more common ones are rheumatoid arthritis. So we have a lot of medication nowadays to treat for this. Rheumatoid arthritis basically is seen in all groups already, although more commonly seen between the ages of 30 and 40, but we've seen even in very young children. So the ability to diagnose this condition very early on and treat it appropriately basically helps in curtailing further progression of arthritis. So these are mainly, arthritis as such is mainly a preventable condition, and most of the time if diagnosed correctly and early on, we prevent it progressing to a point where there is a need for a surgical intervention or a replacement. So the most important thing that a take-home message during this during the World Arthritis Day this year would be to deal with these joint pains. Go see your medical practitioner for joint pains and don't delay it unnecessarily. And even if and when diagnosed correctly, you attempt to curtail it in the bud and prevent unnecessary progression to a stage where a surgical intervention is required. Thank you so much.